Hello, and welcome to Medical Device Today, where we update you on the latest happenings in the medical device industry. I'm your host, Angeline Marie. Today, my guest is Micah DiSabato. He's a director of recruitment for the medical device division at the Morisey-Dart Group. Micah has a proven track record that includes 14 years of experience within the medical device, precision machining, and life science industries, specializing in premier talent in engineering, operations, and quality and regulatory positions. He has filled roles that range from presidents, general managers, and manufacturing leadership to staff-level continuous improvement engineers. His clients include some of the industry's fastest-growing and most successful startup companies, as well as several Fortune 500 industry leaders. And today, we're going to find out just what are some of the latest challenges in the medical device industry. So if you will help me, welcome Micah DiSabato. How are you doing today, Micah?
I'm doing great, Angeline. Thank you for having me on.
Thanks so much for taking the time to speak with me today. Micah, 2015 has already proven to be a big year for the medical device industry. In your opinion, what's impacted this?
As we entered 2014, we knew that the merger and acquisition activity in the industry was going to be at an all-time high. Corporations were sitting on record cash reserves, and the low interest rates in the market clearly pointed us in that direction. Now, what caught me off guard and what I think really caught the industry off guard was not knowing the feeding frenzy that was going to happen between the top 25 to 30 companies as they literally gobbled each other up. What we've entered into is the age of the mega acquisition. Medtronic bought Covidien, J&J purchased Synthes, Becton Dickinson acquired CareFusion, Zimmer is just wrapping up their acquisition of Biomet, Smith & Nephew even snagged ArthroCare. You know, if you put your ear to the street, the rumor right now is that Stryker might be purchasing Smith & Nephew. It's been an exciting year. It's been really, really cool to see some of these completely blindsided us, others we expected along the way. I'm looking forward to seeing what the next year brings.
Now, Micah, last year you spoke out pretty strongly against the medical device tax. Do you still feel like it's having an impact on the industry today?
Undeniably. If we look at the effect that Obamacare, the Accountable Care Act, and the medical device tax have had on the industry, it's been quite staggering, and that's an understatement. With the passing of the medical device tax, there was an immediate demand for continuous improvement savings, minimizing operational costs to help offset that 2.3% tax became priority number one of nearly every organization. Margins became paramount like never before. And we're not talking simply about cutting costs, Angeline, but truly changing processes, taking a 10-step manufacturing process down to 6 steps, supporting automation, really and truly leaning things out. There was an article I read recently that talked about the medical device industry being 10 years behind automotive and lagging maybe 8 years behind aerospace in terms of utilizing Lean Six Sigma and its evolution of continuous improvement. The time for the medical device industry to play catch-up is here, and it's here in a big way. As companies continue to demand additional savings, I think the other natural consideration has to be outsourcing.
Okay, you brought up outsourcing. Now, what would a medical device manufacturer need to see to consider outsourcing?
So what I'm being told is that typically if a company can realize between 10 and 30% savings, it justifies making the move, and that'll yield somewhere between a minimum of 3 to 5 points of increased gross margin. As a result, we've seen significant amounts of growth in contract manufacturing and outsourced manufacturing providers. Certainly that's going to continue through the rest of 2015 and I think into the years to come as well.
And Micah, what new advances and breakthroughs do you think we can see in the industry this year?
Advances and breakthroughs. I love this topic. You know, it's really what got me involved with and what I fell in love with in the medical device industry. I think the newest innovation is really nothing new. It's 3D printing and additive manufacturing. Nearly everyone uses it for rapid prototyping today, but costs have prohibited it from being used in manufacturing. This is quickly changing, and it's going to monumentally impact both manufacturing and the supply chain. I believe that it's going to prove to be the most disruptive technology our industry has seen in quite some time.
And what about the FDA? How do you think they're viewing this new technology?
The FDA, they have their hands in everything. And, I think if you look at the most recent numbers, at the end of February, there were over 85 medical devices that are manufactured on 3D printing that the FDA had already approved. That number is surging. It's going to grow very quickly. The fast and nimble companies that can realize the benefits of 3D printing and what it brings, they're going to enjoy increased profitability and certainly a leg up on their competition. They're going to be able to do this while they attract the best and brightest engineering minds in our industry. Who else would a young up-and-coming superstar want to work for than a company embracing that innovation, embracing technology? This is the future. Angelina, I believe we're on the verge of witnessing a massive space race. Just as the United States once raced the Soviets to put a man on the moon, companies right now are competing with each other to see who can be the first to build the best and most advanced manufacturing space yet. Envision with me a mega printing complex. It's got 1,000 3D printers running 24/7. That vision's going to happen. It's going to be here a lot quicker than people think, and I'm excited to see who the company is that gets there first and how long it takes them to get there.
Now, Micah, you speak to executives and hiring managers within the medical device industry every day. What are you hearing from them as far as their pain points? What are their biggest challenges right now?
That's a great question. If we step back through what I just discussed, I think it all began with the passing of the medical device tax. As it approached, the phones at our office blew up. Continuous improvement engineers, Lean, Six Sigma, Toyota Production System, everyone had a need for these. Demand changed everything. And that same type of demand today is changed as 3D printing and additive manufacturing are commanding my phones to blow up again. Transferring products from CNC machining to 3D printing is the new major focus. Ensuring that these new processes that are used in additive manufacturing have those same maximized manufacturing efficiencies is continuing that demand on continuous improvement engineers. Now, there's another demand, and that's with validation experience. Engineers that can help expedite those manufacturing process transfers through the validation process. IQs, OQs, and PQs, these are the new skills that are in demand. Lastly, quality professionals have been in tremendous need for the last few years. I don't see that being minimized because of the effect that the FDA has. That's certainly, I guess, an overview of the staffing demands today. That being said, Angelina, I think the true challenge in this increasingly competitive candidate-driven market is identifying premier talent, expediting the hiring process, and extending an exciting package faster than anyone's competitors. That's really something I'd love to be able to talk about for an hour, about how companies can enhance that candidate experience. But for time's sake, we're going to have to save that for another day.
Now, Micah, how do you and your team deliver staffing solutions within such a fast-paced and changing industry?
I think the key to every search we have is understanding the specific needs of our clients. We customize each search solution specifically for their opening. Over the last year, about half of our searches, 50% of them have been retained. The other half have been traditional contingent. What's interesting is the old retained model has been thrown out the window. We've used retained searches incredibly successfully for clients on lower level positions, and we've even done contingent positions on executive level roles with the same type of success. It's being able to understand specifically what their needs are and customizing a solution. That being said, I have to say I am a passionate recruiter. I need to understand why your opportunity is exceptional, why your company is exceptional, how your products differentiate themselves in the marketplace, why the hiring manager is someone that we would want to work for as a young engineer. And most importantly, tell me about your processes. What makes them outstanding? And if they're not outstanding, what can my individual bring to the table to make them outstanding? I need to understand all of these things, the things that aren't written on a written job description. For me, it's essential that I need to be able to understand these so I can stand behind each opportunity, feel passionate about them, and sell them to candidates in the marketplace that are getting bombarded with phone calls for other recruiters for bland jobs all day, every day. Once I am able to do this, I can engage in the process, and our research team will take off. That's where things get really exciting. Now, I've personally recruited in the medical device space for the last 14 years. My team and I work all day, every day, exclusively in this marketplace. I'm also the founder of one of LinkedIn's fastest growing groups, Medical Device Premier Talent. What we do is we know how to leverage each of these things to be able to provide expedited solutions of premier talent to a very select list of clients. I think it's what differentiates us in the market and will prove to be a tremendous experience for any of the new companies that we bring on board.
Well, listen, Micah, we're almost out of time for today, but before we close, what information would you like to leave with the listeners? How can they get in touch with you if they have any questions about your services or the medical device industry in general?
Absolutely. I love learning about our industry and the new companies that are popping up all the time. I certainly welcome the opportunity to speak with other experts in the medical device space. You can reach me directly at 239-598-9386. You can also connect with me on LinkedIn or view our website at www.morisey-dart.com. And Morisey is MORISEY-DART, Morisey-Dart.com. Angelina, I really appreciate the opportunity to speak with you today.
Micah, thanks so much for speaking with us today. Until the next time, listeners, goodbye from Medical Device Today.